Official International College of Doctors, Doctors of the World United. We present our distinguished Doctor Honoris Causa of the Official International College of Doctors, Dr. Martin Azanza, with the lecture, Diseases of the 21st Century.
Hello, and a very good morning to you all. I am Dr. Martin Azanza, and joining you today from my home in Spain, I would like to sincerely thank the Official International College of Doctors for the kind honor of inviting me to participate as a speaker. In this particular instance, I am joining you remotely to contribute to the 7th Virtual Congress on Excellence in Life, and I am truly delighted to be a part of this important event. Since I know the presentations last 30 minutes, and to be respectful of that, I am going to set a timer, and I will try to tell you what I want to share in 30 minutes. I am going to talk specifically about the diseases of the 21st century and about the use of nanoniced glutathione in the prevention and treatment of metabolic diseases. And for that, I am going to share this PDF that you see on the screen, and we are going to develop it together. Well, for those who want to know about me, here is a QR code that you can scan with your mobile phones with the reader to learn a little bit about my biography, or to access my social media or the YouTube channel where I have many of my lectures. The first thing we ask ourselves when we talk about health and preventive medicine is why we get sick. And basically, we get sick because we are exposed to toxins. We also get sick because each one of us has a specific genetic vulnerability. And we get sick because often we have a lifestyle or habits that do not support health processes. All those habits and lifestyle choices that can modify the expression of a gene without altering the sequence in the DNA strand are known as epigenetics. In other words, everything related to gene expression, but which does not alter the DNA nucleotide sequence. And it is precisely in that combination of genetics and environment, let's say, of environmental epigenetics, where the vast majority of chronic diseases find their explanation. We consider the environment to be external factors, such as the food we consume and the additives it contains, the water with those contaminants that are inherent to it, the air we breathe with all the microparticles in suspension that we shouldn't be breathing, the drugs we take by medical prescription. Then it is important to consider as harmful environmental factors, right? Whether there is the habit of smoking, whether the person regularly consumes alcohol, whether they practice physical activity or not, whether they have a healthy diet or not, whether they are subjected to the influence of non-ionizing radiation, those known as EMF and ELF, right? It is not the same to live in front of a cell phone antenna that emits and receives 5G signals as it is not to live in that environment. I mean, it's not the same to live in a high pollution urban environment as it is to live in the Norwegian fjords, further away from polluting elements. And on the other hand, we also refer to what is the internal environment, right? Which is our cellular biochemistry, our inflammation processes, infections, the oxidative stress that is generated in the organism by free radicals, the mechanisms of eubiosis and dysbiosis, I repeat, of balance or imbalance in our microbiome, in our intestinal flora, in our digestive flora. That is the meaning of dysbiosis. It is the imbalance in the intestinal flora. Evidently, emotions play a very important role, don't they? Because we all have a psychoneuroimmunoendocrinological axis. It is like a highway that travels from our brain and our limbic and emotional system to our intestines and vice versa. A brain-visceral axis that has its toll booths in the immune system, in the endocrinological system, and the entire hormonal component. So evidently, those are internal factors that must be managed, and negative emotions generate a cellular biochemistry of distortion. And that is why it is so important to promote the hormones of happiness. Those of us who work in medicine, especially in environmental medicine and preventive medicine with epigenetic and genetic variables, develop a concept called the exposome, which would be the totality of internal and external exposures that a person can be subjected to from the moment of conception and throughout their entire life. That is to say, it is the set of internal and external exposures that have an influence, right, on our biology. And environmental medicine is precisely a transversal discipline that, in my humble opinion, should permeate all medical specialties, because we really find a relationship with the vast majority of metabolic disorders and diseases of the 21st century, or of civilization, as I like to call it. This is a graph of how we live, right? Where you can all see that we are subjected to high levels of pollution, whether it be from the industries that manufacture, right? Due to the amount of polycyclic aromatic hydrocarbons, radiation, chemical compounds, the pollution in the water, and that from animals. And anyway, we end up taking all of that to our plate, isn't that right? To our family's table. And that circle ends up being a harmful circle, just as can be seen here in the arrows that follow, in a way, the clockwise direction. There are two phenomena that must be taken into account regarding pollution. The phenomenon of bioaccumulation, which evidently occurs in the same species, right? Or in species of the same genus. For example, methylmercury in fish, or biomagnification, which is in this specific case, it can be observed well, right? A worm that is infected or contaminated is the food or the energy substrate for birds that are going to consume it and that are going to go on accumulating and amplifying it means, right? That contamination. Then a reptile that is going to feed on that bird, a bird that is going to feed on that reptile, and that is the phenomenon of biomagnification. So I wanted to explain the concept of the exposome because it gives us the introduction to understanding what 21st century diseases are, and to be able to explain, and for you all to understand, although I will do it in the most pleasant and colloquial language possible, what the biological causes of 21st century diseases are. Let's get to it. What are diseases of civilization or 21st century diseases? These are chronic conditions of medium and long duration, mainly cardiovascular diseases, neurodegenerative diseases, metabolic disorders such as diabetes mellitus, being overweight, obesity, cancer, autoimmune pathologies like Hashimoto's thyroiditis, or systemic lupus erythematosus, or rheumatoid arthritis. Different respiratory conditions such as bronchitis, pneumonia, and even chronic obstructive pulmonary disease, known as COPD. Notice one important thing, dear colleagues. The leading cause of morbidity and mortality in the Western world is precisely these diseases of civilization. And the four causes that I identify, that is to say, the four biological reactions at the cellular level that I uncover, are chronic inflammation, oxidative stress, glycation phenomena, and cellular exposure to environmental toxins. Chronic inflammation is the first point I want to discuss. And if we look at this graph, it is related to depression, cancer, cardiovascular diseases, metabolic diseases like diabetes, and autoimmune, inflammatory, and neurodegenerative diseases. In other words, chronic inflammation is present in all these pathologies, and the inflammatory reaction is a necessary immune response in the body, right? When we have a chemical, physical, microbial, or environmental aggression, that is to say, it is a natural mechanism, a necessary mechanism, but it must be controlled and it must be executed in a short period of time so that there can be, for example, tissue regeneration. That is known as tissue regeneration, which we manifest symptomatically with pain, edema, and redness. As long as it lasts a short time and is controlled, the inflammatory reaction is natural and necessary. But when that inflammation persists, that is to say, when it is persistent, somewhat in relation to the term chronic, it begins to modify the tissues. It begins to modify the metabolic pathways, and it ends up favoring the development of the chronic diseases that we just mentioned in the chart. The second biological cause is oxidative stress. Free radicals are reactive waste products of metabolism. Free radicals are basically reactive oxygen species mainly. There are also nitrogen and sulfur ones. They are like atoms that are very restless and move at extremely high speeds, inflaming the organism. Let's call it that, free radicals. And evidently, these reactive oxygen species oxidize cellular components. They oxidize DNA, they oxidize our cell membranes, they oxidize proteins. And I call this the paradox of our biology, right? Because we need oxygen to live, but at the same time, this oxygen progressively oxidizes us as we breathe. When we have ideal conditions, the antioxidant capacities we have in our body inhibit the excess of free radicals, because free radicals, just like inflammation, are necessary in adequate concentrations, but if we have an excess, they are harmful to health, and that is why we compensate for them with antioxidants to prevent chain reactions from being generated and from those spreading to organic structures. But when the internal capacity we have to generate antioxidants is exceeded, or when there is an excess of oxidation, or both things happen, we are in what is called a state of oxidative stress and a free radical amplification loop. I was just mentioning that it is important to have free radicals in adequate concentrations, right? Low or moderate, that is. Because they are important for signaling at the cellular level, for regulating insulin receptors, for the apoptosis of defective cells, the apoptosis of programmed cell death, very important, especially in defective cells, in cancer cells. It is also important to have low or moderate concentrations of free radicals to induce the mitogenic response for cells to mature and for our defense system to be activated. But when the concentrations are very high, that is where we see Alzheimer's, Parkinson's, heart failure, preeclampsia, cataracts, rheumatoid arthritis, sclerosis, ischemia, arteriosclerosis, and even cancer. In other words, a free radical is a beneficial or harmful substance depending on the concentrations we have in the body. And as I explained, they normally have an unpaired electron that makes them very reactive, right? Very restless, moving at high speed and generating inflammation and problems. And that is why we need antioxidants, which work by providing a charge and stabilizing them. And mainly the reactive species are oxygen-based, although there are also nitrogen and sulfur-based ones. The oxidative stress we are explaining causes damage to our DNA. And that damage is generated not only by oxidative stress, which is one cause, but also by chronic inflammation processes, by metabolic pathways that are disrupted, by unhealthy habits, such as smoking or alcoholism, and by the radiation to which we are unfortunately increasingly exposed, both ionizing and non-ionizing, which also have a lot to do with it. Sometimes due to not taking the necessary care when exposed to the sun, and evidently due to environmental pollution. The other biological cause I want to mention is glycation. When does glycation occur? When sugars bind to proteins. And what does that generate? It generally generates advanced glycation end products, which we call glycated substances, in which the sugar alters the quality of the protein and the function of the protein. Let's keep in mind that hormones, enzymes, antioxidants, neurotransmitters, right? Like oxytocin, dopamine are basically proteins, right? They are composed of proteins. So if we alter the structural quality, we are ultimately heading towards premature aging processes and the progressive development of metabolic and neurodegenerative diseases. Something that happens commonly is toasting bread a bit too much or overcooking meats, right? And those blacker compounds appear, which are, normally they are heterocyclic amines that can be carcinogenic. And that reaction at a biochemical food level is called the Maillard reaction, and they are actually glycation reactions. So it is very important to avoid those acrylamides and those heterocyclic amines from the Maillard reactions. And it is also very important to have adequate control of blood glucose, that is not to enter into states of insulin resistance or diabetes, or to be treated if one suffers from that particular health situation. Normally, glycation occurs when a sugar binds with a protein. Eventually, that bond can occur between a sugar and a fat, but it is most common for it to happen with a protein. The fourth biological cause is cellular exposure to environmental toxins. Currently, we have about 800,000 deaths per year here in Europe that are attributable to the environmental exposure, right? To all the contaminants present in food, in drugs, in water, in the air we breathe, in personal hygiene products, in cosmetics. Just think how sad it is to report that in 2019, in Spain, 30,000 people died of myocardial infarction related to air quality because they did not have a congenital heart disease, nor ischemia, nor did they have cardiovascular history. So in the end, these environmental toxins increase the prevalence of cancer, cardiovascular diseases, diabetes, overweight, hepatic steatosis, right? Which is when we have non-cirrhotic type fat in the liver, allergies, autoimmune diseases, infertility, and evidently neurodegenerative diseases. That is why I find this relationship between metabolic disease and the disease of the 21st century or of civilization with a very clear epigenetic component in it. Even the World Health Organization defines them as having a chronic characteristic that affects the quality of life of those who suffer from them if they are not treated in a timely and periodic manner, evidently. All of them involve low-grade systemic inflammation and oxidation, oxidative stress. That is to say, inflammation and oxidation are present in all the diseases we currently suffer from. Oxidative stress is a particular type of stress that occurs precisely because of what I was explaining about free radicals, about this amplification nucleus. And it is very dangerous because it is asymptomatic, it has no specific symptoms, it is very difficult for health professionals to recognize. We perform common clinical analysis and we don't detect that there is oxidative stress. So we normally have to provide antioxidants to the body to ensure that there is a balance between oxidants and antioxidants. To resolve that imbalance in the scale, we then provide more antioxidants. There are natural exogenous ones, that is to say that we can provide ourselves through food. Isn't that right? For example, vitamin C from citrus fruits, from eggplant, from peppers. Vitamin E, very present in flax seeds, in nuts, in some cruciferous vegetables. In olive oil, the omegas and vitamin E as well, the phenolic acids in coffee, for example, the polyphenols in grapes, the carotenes in tomatoes and carrots. Those would be natural exogenous ones. Then we have synthetic exogenous ones. We can consume, for example, butylated hydroxyanisole, ethoxyquin, N-acetylcysteine, and its amide, right? Edaravone. And on the other hand, we have endogenous. That is to say, we produce it ourselves, but not in sufficient quantities. For example, superoxide dismutase, melatonin, lipoic acid, coenzyme Q10, and the most important of all, glutathione. Glutathione is the master antioxidant, and we all produce it with very good production and efficacy until we are 20 years old, but then production decreases by approximately 15% for every decade of life. So obviously, if you do the math as the years go by, our glutathione production is notably diminished. And as I mentioned, it is the master antioxidant, Master Yoda, right? The one that is going to donate that electron to the free radical to stabilize it. Basically, glutathione is a molecule composed of 3 peptides. That's why it's called a tripeptide. It is composed of 3 amino acids. That's what that means. Biglutamate or glutamic acid, biglycine, and bicysteine. Of the 3, cysteine is the scarcest, and it is the one that contributes the sulfhydryl group, where the sulfur is, to the molecule. It would be here where I am marking with the cursor. This is the amino acid cysteine. When the cell has cysteine in sufficient quantities, it manufactures sulfhydryl glutathione efficiently. And it is that glutathione that is the master antioxidant. What are the roles that glutathione fulfills in the organism? These are the most important ones. We could talk about many more because there are about 170,000 publications on PubMed about glutathione. I highlight these: immune function enhancer, toxin eliminator, eliminator of carcinogens and endocrine disruptors, that is, substances that unbalance the hormonal axis, a very powerful antioxidant, protector against ionizing and non-ionizing radiation, such as Wi-Fi, for example, which would be a non-ionizing one. An ionizing one is the one from an X-ray, for example. Glutathione participates in DNA synthesis and repair. It participates in protein synthesis. It is a cellular mediator of prostaglandins and leukotrienes, which are lipid mediators of inflammation derived from arachidonic acid. It is an enzymatic regulator and an enzyme activator, and it is an amino acid transporter. We have already tests of scientific evidence of the usefulness of glutathione in diabetes mellitus. For example, when the relationship between glutathione and blood sugar was investigated, it was seen, right? And a correlation can be observed between the availability of cysteine and insulin resistance. It has also been done with diabetic infections, right? Diabetics are immunocompromised. They normally present a higher rate of infection, and we see, let's say, the benefits of glutathione in the patient also who suffers from diabetic infection. And we also find a relationship between glutathione consumption and diabetic kidney disease, where the protective effect of N-acetylcysteine and glutathione on the kidneys and renal function was scientifically demonstrated. Also, with pathologies cardiovascular related to diabetes, we have seen that the main cause of complication and death in diabetes is the alteration of circulation. In other words, vascular disease is closely related to dangerous levels of circulating fat, which oxidize due to the action of free radicals, and that is why it is so important to provide antioxidants, right? and this is done by an enzyme called glutathione peroxidase. We need glutathione for this. On the other hand, the lining of the arteries, which is called the endothelium, is also sensitive to this oxidative stress. That is why we need glutathione to precisely modulate that stress. In diabetic neuropathy, we also find correlations, and in retinopathy, right? Which is when the visual receptors of the retina are damaged. In other words, it is widely demonstrated that glutathione is a complement, an important supplement in the treatment and also in the prevention of diabetes. We also have scientific evidence for its use in hypertension. Isn't that true? When we don't identify a single cause for hypertension, we call it essential hypertension. Some people are born with glutathione enzymes that are anomalous, let's say, not normal, right? And they present a greater risk of having cardiovascular diseases, including arterial hypertension. A team of scientists in Poland observed that as glutathione levels decrease with age, there is an increase in blood pressure. In general, individuals who have essential hypertension have low levels of glutathione. That is what has been measured. And when we treat it appropriately, those glutathione levels normalize. So this raises the question, chicken or the egg? In other words, do I use glutathione to regulate blood pressure, or do I treat the blood pressure to regulate glutathione? Basically, what we have demonstrated scientifically is that there are protective effects, vascular protective effects of glutathione on the endothelium and in maintaining tone. So in this case, it would be, I give glutathione to help the angiotensin mechanisms regulate blood pressure. So a health strategy would be a healthy diet, a healthy lifestyle, which entails moving away from bad habits and practicing physical activity, or at least not being sedentary, and glutathione in dyslipidemias, right? In the accumulation of lipid plaque, it is also important. Dyslipidemias are, for example, hypertriglyceridemia, when you have an excess of triglycerides, or hypercholesterolemia, when you have excess cholesterol levels, which is very dangerous, obviously, because it can generate atheromas, right? And it obviously increases the risk of cardiovascular pathology or a cardiovascular event. We also have scientific studies that show us at the University of British Columbia the correlation between cholesterol, glutathione levels, and the formation of atheroma plaques in the aorta. So it would be very important to consider glutathione in the treatment of atherosclerosis. It is also used for other pathologies. There is scientific evidence documented in PubMed. Some 120,000 articles are published on these specific topics. Detoxification of heavy metals and chemicals, very useful in chronic fatigue syndrome, for example, or in multiple chemical sensitivity syndrome. Use of glutathione to strengthen the immune system for cancer treatment, to prevent premature aging, for the cardiovascular diseases I mentioned, for the metabolic diseases I mentioned, for digestive ones, for kidney failure, for periodontal disease, for dermatological conditions, and for those affecting the nervous system. Why do glutathione levels in the body decrease? Because we age, not necessarily prematurely, due to stress, pollution, and because we often have diets and nutrition poor in proteins and amino acids that contain sulfur, that is to say, basically poor in cysteine. How do we measure the need for glutathione? We do epigenetics. We analyze hair strands in a bioinformation laboratory in Germany, which is in Hamburg, of which I am the medical advisor for Spanish-speaking countries. We perform an aminogram of our patients to know which amino acids are covered at the cellular demand level and which are not, paying special attention to the three peptides that make up glutathione, which are cysteine, glutamic acid, and glycine. And evidently, we take advantage of the hair strand study to know what the antioxidant profile of our patient is, as well as the mineral one, placing special emphasis on selenium, vitamin C, and zinc. What is the indicated dosage for taking glutathione? Well, often it can be personalized and should be personalized, but a standard dose of 10 milliliters a day, taken at 4 in the afternoon sublingually, is a very good dose for prevention and treatment. If we already have more complex situations, the ideal thing is to make, let's say, a personalized prescription taking into account an anamnesis, right? The interview conducted with the patient, their diagnosis, knowing their habits and lifestyle, what medication they consume, knowing the xenobiotics that is within the epigenetic study, knowing which metabolic systems are affected, and what the degree of toxemia is of, let's say, exposure to toxins that the report is suggesting. And in many cases I do, in my particular case, genetic and pharmacogenetic studies. how long can a person be supplemented with glutathione? As long as they need, but normally 1 year a month, right? When we are already over 40 years old. An antioxidant profile is something I usually measure after a year. A mineral profile, a contaminant profile. I do another aminogram. I analyze my patients' metabolic systems to see how they synthesize proteins, right? What the sleep pattern is like, whether they are repairing at a cellular level or not, and if how their immune system is, obviously. How do we restore glutathione levels? Well, we use glutathione in nanoparticles. This product, which is called NutriSwiss, is manufactured in the United States, and we market it in 60 countries. It's composed of glutathione, curcumin, and L-cysteine, which is the precursor to cysteine, and a skin product called NEUMI Skin. What's novel is that it is nanonized. A nanometer is equivalent to 1/1,000,000th of a millimeter. So this makes it very soluble, very bioavailable, and the product is utilized much more effectively as if it were intravenous. It is as effective as, or even more effective than, an intravenous treatment. And this is what revolutionizes this product, the nanonization. So we have a complete molecule with all the amino acids nanonized, right? It easily penetrates the cell membrane, and we absorb it incredibly quickly. It is completely non-invasive, and it is not painful at all because we do not administer it intravenously, but rather we deliver it sublingually. You should leave it under your tongue for 40 seconds, then rinse it thoroughly around your mouth for 3 or 4 minutes, and finally go ahead and swallow the product. So of course, this means that it doesn't degrade in the gastrointestinal tract because it goes directly to the heart, and the heart pumps it wherever it's needed. And obviously, it ensures, well, high availability. This is the QR code for our global health project, which you are all invited to participate in or to consume the product if you like what I've told you. And the website, in case you're not big on QR readers, well, I have 20 seconds left to give thanks, 20 seconds to reach the 30-minute mark. Thank you all, and God bless you.
International Official College of Doctors. Doctors across the world have united.